You don't have the big needle for Novocaine. You don't have the big drills that make you nervous the minute they turn them on. And so using all of the new technology and equipment that's out there just makes it not only a lot less pain, but a lot less anxious. You really feel like you're not even going to the dentist. It's like, okay, I happen to be here in this really cool place, and while I'm here, they're doing something to my teeth.
Laser technology has eliminated the need for shots and drills in filling cavities.
When I came into the chair, I was waiting for the needles and the gas masks of the past, and in came lasers, and I walked out feeling just as good as when I walked in.
I have a demonstration for you. Would you rather have this, ow, that hurts, working on your mouth, or would you rather have this, a laser working on your mouth? Dr. Garner, I want to talk a little bit about people who are phobics. Whether you're a phobic or not, no one wants a drill working on their mouth, but so many dentists still use it.
Well, many years ago when I was still a dental phobic, I absolutely hated this thing. I was terrified. Yes. I wanted to avoid it at all costs. And I hoped at that point, I wish, why doesn't somebody come up with something better than this thing? And my wishes have been fulfilled. A few years ago, dental lasers were created. And what this enables us to do is do fillings and basically have no pain whatsoever, and also numbs as you go. And the cool thing is, the only thing that touches your tooth is light, water, and air. It doesn't have a drill bit spinning. It's only light, water, and air, so it's totally painless. It's an awesome invention. Our patients love it.
I always know, just to start with, that I'm going to get the best treatment possible. I know that they are dedicated to that, so I know they're going to get the best equipment. I know they're going to have the best people, and I know that since they're dedicated to that, I don't have to worry so much about, well, do you have the latest such and such? Because I know they take care of it.
Kim, this is another instrument that horrifies most people. It used to horrify me.
Me too.
The infamous shot that everybody hates. Well, we have something new and improved, vastly improved. It's an electronic number that enables us to make your face numb, your tooth numb, without pain, absolutely no pain. Our guests don't even know they've been numbed at all.
Probably my favorite piece of equipment here is a electronic numbing injector. You don't know it's happening. It doesn't hurt. It's not bothersome. It's not painful. And when Dr. Garner uses that device on me when they have to do a little more extensive work than normal, it's just, the pain goes away, or the pain never even starts.
Kim, this is another one of my favorite all-time dental instruments. When I was a dental phobic, many years ago as a child, the pick here got stuck in a cavity in my tooth by the dentist, and it was excruciating. Thank goodness now we have something new where we don't have to use that anymore. It's called a Diagnodent. It's a laser. All we do is shine it on your tooth, the light, and it tells us if you have a cavity or not. Also, it gives us a number here which tells us exactly how bad your cavity is before we even go into your tooth to fix it. So it's a
Am I good?
You're great. You're excellent. It's a wonderful new technology, so we don't have to have that pick.
Dr. Garner has all the best technology, and that is part of what's made my experience even possible at all.
Dr. Garner, I want to talk a little bit about what's in front of us. Now, this is the latest as far as technology goes that you've incorporated at Dental Bliss.
Yes, Kim, this is a Velscope. It's an instrument that allows us to detect oral cancer at a very early stage, which saves lives.
Right.
Because the 5-year survival rate for oral cancer is 52%, but if you detect it early, it goes up to 90%.
Wow.
So this finds it at an extremely early stage. We've never had anything like this before. Before, all we could really do was just look in your mouth with our eyes to detect it, and sometimes we could actually miss it because it would be real apparent with visible light. The way this works is it shines a different wavelength light into your mouth, and if it's cancerous or precancerous, it glows a different color so we can see it very easy and very plainly.
Okay, how does it work?
It works just like this. Just turn it on. It's kind of like a flashlight. I just look in your mouth and look through the back of it, and if there's anything wrong there, I can see it. It glows. You look good, so you're safe.
When you come to our office, you're not getting somebody that's just here because of a paycheck. We're here because we love what we do and we care about who you are.
Now talk about a time saver. This machine right here is going to save all the guests a lot of time.
That's right, Kim. This is called a CEREC machine. It's a CAD/CAM machine for our techies out there. And what this enables us to do is make a crown while you wait.
Wow.
We do an optical impression right after we prep your tooth. We send it to our milling machine, which makes the crown in 15 minutes. We come back in the room, we cement it permanently. It's great because you don't have to come back in 2 weeks to get the permanent one cemented on your tooth. It saves you a visit. You get it all finished the very first visit. It's an awesome new technology. Our guests love it.
And I had heard that Dental Bliss used sedation dentistry.
There were multiple procedures that they were able to do in that one day.
And I thought, boy, I'd sure rather not have to deal with the needles coming at me and the drills and the sounds and the smells.
None of the pain, none of the discomfort, none of the anxiety.
I thought, well, I'm going to go ahead and try it, and came here and had a perfectly wonderful experience from start to finish.
Now, Dr. Garner, I want to talk a little bit about your sedation technology. It's certainly a growing part of your business, and your guests love it.
Absolutely, Kim. We've done thousands of sedations on folks from all around this area. It makes it so easy because we just give them some pills, they go to sleep, they're totally relaxed, they don't remember anything. They go home, they wake up, and they don't remember anything other than taking a pill. So it makes it so easy for them. And it's neat because we can get a lot of work done because they can sit in that chair for 5 or 6 hours with no awareness of the time going by.
Right.
So we can get a whole lot of work done in one appointment. It is wonderful. One of the best things we do for folks.
To learn more about the procedures at Dental Bliss, go to our website, dentalbliss.com. Do you want to improve your smile? Smile makeovers when we return. Gum disease has been associated with an increased incidence of heart disease, strokes, cancer, arthritis, diabetes, and pregnancy problems.
My teeth were crooked and they were also very stained, and they just weren't pretty.
I was self-conscious, I didn't smile, I was embarrassed.
If I would smile, I would put my hands over my mouth.